Hi guys, today we are going to talk about urinary tract infection prevention. As we know, or as most women know, UTIs are really common and are usually caused by the bacteria E. coli. So how does that E. coli get there? Usually it's through sex. That's usually when I had a UTI, is usually after sex. And through my 20s and my 30s, I had quite a number of recurring UTIs. And I didn't understand, even as a scientist, I didn't really quite get what I should be doing up until quite recently, like a year ago, basically. So, Western medicine will call for antibiotics right away. As soon as they see a positive test, they'll give you antibiotics. And antibiotics has been so overprescribed. This is most likely why we have those superbugs occurring and the bacterial resistance towards antibiotics. So really, if you're having recurring and frequent UTIs, it's all about prevention. Because the more antibiotics you take, the more harmful it can actually be for your body, because you're eradicating both positive and negative bacteria, and you need that positive microflora to be present in order to fight off that negative bacteria. So, it's really harmful to have frequent UTIs. And I think, personally speaking, there are studies that actually showcased that E. coli can reside and just sit in the bladder region. And I think that's what I had, perhaps. Either way, I didn't really quite know what I had to do until, like I said, like a year ago. So what hasn't worked for me, drinking a whole bunch of cranberry juice has not worked. I do think, though, the vitamin C might be a benefit. But really, once you have an infection, usually cranberry juice won't do much, especially if you have recurring UTIs. Also, D-mannose, I actually took probably too much D-mannose at one point, and when I went to have a test done, the doctor thought I had like diabetes because I wasn't getting rid of all that sugar. So I don't recommend D-mannose either. Of course, there's, your doctor will tell you to pee after sex. Make sure that both parties have clean bodily parts, before sex, and to drink lots of fluids, to keep hydrated. That definitely helps. However, I will share with you my regimen daily. So I take 2 probiotic capsules a day. And this is the Natural Factors, has 12 billion good bacteria. And so this is twice a day for me. Also, I take vitamin C. They're just chewables. They're probably like kids' chewable vitamin C. And that's 500 milligrams once a day. Some people like to take once in the morning, once at night. It depends on how well your body will digest that vitamin C. I found that for me, once is good enough. And so to me, this is actually the most important part, is what you're wanting to do is you're wanting to provide good, healthy bacteria up the urethra and into the urinary canal to prevent that E. coli from causing that infection. So if you do have E. coli that likes to sit around and party in your bladder region, having probiotics travel up your urinary canal will actually be quite beneficial in warding off that E. coli. And it's funny, as a scientist, I can't believe it took me that long to figure that out. So this is what I use. It is Nancy's probiotic kefir. And if you don't know what kefir is, it's basically like this yogurt drink. This has like 64 billion CFUs of good bacteria per serving. CFUs are colony forming units. So I think what that means is that each of these guys can form a colony of bacteria. So that's a lot. That's a lot of good probiotics. And so remember to shake it. What I do is I literally take my finger, I take some of that kefir and place it right on my urethra after peeing. So you can do this throughout the day if you're feeling, you know when you're about to get a UTI. But even before that, after you pee, put some on your urethra. You can use a Q-tip if you don't want to use your fingers. And right now, I don't normally feel like I have to do it during the day anymore because my body feels really good. I normally just do it in the evening, so before bedtime, and then during the night when I have to get up and pee, which is at least once, and then probably again like in the morning. So this has actually worked for me quite well. Probably, all of this put together, specifically the kefir. And if you don't have kefir, yogurt, plain yogurt will probably, be sufficient. And I have not had a UTI in almost a year. And that's pretty good for me because I felt like, there were a few times where I probably had, recurring UTIs like once a month, which is way too many. So yeah, this is, I feel, a great preventative method. And I think all women who have recurring or frequent UTIs should practice this and just remember some of these healthy measures you can take in order to keep your body healthy, because UTIs are absolutely no fun, as we all know. And yeah, so hopefully that helps. If you have any questions, feel free to message me, but good luck. And I hope that the Western medicine world and the Eastern medicine world and the natural medicine world come together in order to make recommendations for their patients, because it's really, you have to look at the entire body and you have to look at the patient's history in order to determine what is best. And it's not always about a treatment. A lot of the times it's actually about preventing illness. So yeah, stay safe, stay healthy, and thanks for watching. Bye.